see.
Welcome to the American Nurses Association Conferencing Center. Please enter your passcode followed by the pound sign. Your passcode has been confirmed. Please wait while you are joined to the conference. Conference has not been initiated. You will be placed on hold until a chairperson arrives.
Until a chairperson arrives. Whoa.
It's a good sign, Ian.
Yeah, so far so good.
So far, so good.
Hi, is this Ann Morgan Mostosi?
This is this Dr. Havens?
It is, and please tell me, did I pronounce your last name correctly?
It was perfect.
Okay. So I need to know if you can hear me all right. Is it clear?
It's very clear.
Okay, thank you very much. So do you have a few friends with you?
We have just a few friends in the room.
And how are things in sunny California, the desert?
As you said, Dr. Havens, sunny. It's always sunny in Southern California.
Oh, wow. I wish I were there right now. Well, let me begin. You're not here to hear about my desired vacation plans. So, my name is Donna Havens, and I am the chair of the Commission on Magnet, and I'm calling today on behalf of the Commission on Magnet and the Magnet Program office staff, in particular Christine Curto, Senior Analyst, and Becky Matthews, Magnet Analyst. And I need to tell you that the Commission has reviewed all of your documentation and the findings from your site visit, and as a result, it is my honor to officially notify you that the Commission on Magnet has unanimously voted to credential Eisenhower Medical Center as a Magnet organization. Feels pretty good.
It feels wonderful. Dr. Havens, I am just privileged and proud to accept the designation on behalf of all Eisenhower nurses. Live a model of care that embodies genuine caring and a professional and evidence-based practice. So I would like to thank the Commission on Magnet, the entire Magnet program, and especially Christine Curto and Becky Matthews for being very patient with us. And we appreciate all that you have done to recognize excellence in nursing. Thank you very much.
Well, you're most welcome. You have certainly earned this, and we certainly feel you deserve this. Might I take just a couple of minutes to share some of the observations we made and some of the comments, outstanding comments that the reviewers made about your organization?
We would love to hear them.
Okay. Well, there were several items and standards that actually we felt were exemplars in your organization, and I'll share just a few tidbits. And one of them was Transformational Leadership 2A. You probably know what all these numbers mean, yes. But it relates to nurse leader advocacy that resulted in allocation of resources to support a goal. And the most distinguishing resource that the clinical nurses and leaders have secured is funding for nursing education. And that was clearly evident in your documents and on your visit that nursing education is genuinely valued and supported across your organization. And the resources that you, the CNO, has advocated for and allocated to achieve the BSN goals at Eisenhower include financial support in the amount of $5,200 per year for each nurse. And interest earned from the Bannon Fund also helps to support this, which is supplemented by the organization's operational budget as needed. This is truly commendable, and your goal is that by August 2015, 56% of your nurses will hold a BSN degree or higher. That's excellent.
Thank you so much.
You are welcome. The next exemplar relates to input from clinical nurses that was used to modify nurse staffing assignments. And this, we targeted the Eisenhower Lucy Kersey Infusion Center. That is a regional service line with 85 chairs in 5 locations. The number of patients served was increasing, and the method of patient assignments for nurses was informal. However, the clinical nurses conducted and evaluate, you talk about evidence-based practice, a search of the literature, a time and motion study, and baseline and post-change assessments of nurse and patient satisfaction to ultimately develop a unique and creative acuity system. The result was that you developed the Eisenhower Medical Center Acuity Rating Scale, an assignment tool that includes a 1 to 5 point rating scale to better manage patient flow. And all the nurses thought this brought fairness and predictability to their workday, along with confidence that there is sufficient time for them to meet the needs of patients. This was, again, outstanding. And the last exemplar we want to note is the outpatient and inpatient ambulatory nurse-sensitive clinical indicators. And the one point here was that the Joint Commission Stroke Patient Education Core Measures benchmark was met over, you met at least the mean over all 8 quarters presented. And the organization also demonstrated outperformance of the National Quality Forum benchmark for percent of 30-day readmissions for all-cause COPD readmissions. Again, over all 8 quarters presented. This is outstanding. Congratulations.
Oh, thank you.
So in summary, I just want to say that you are now joining 26 magnet hospitals in California, and this is testament to your commitment to nursing excellence. We applaud you for your organization's dedication to your nurses, the entire healthcare team, but most importantly to the patients you serve. So we hope you will be joining us at the Magnet Conference in Atlanta, Georgia in October, where your organization will be recognized officially at that time, and I would love to meet all of you.
Thank you, and we plan to be there.
We hope so. It would be fun. It would be fun. So it sounds like maybe you're ready for a party in the sun.
We are.
Okay, so you go enjoy. We wish you well. And again, from the commission and the staff, I say congratulations.
Thank you so much.
Bye-bye.
Bye-bye. Thanks again.
You're welcome.
I hate to be sitting down, but you know, I just want to say thank you to an amazing group of nurses and all of our clinical partners. And this is a reflection of reality. You know, I think many times organizations have academic resources at their beck and call. They have, you know, they have many different kinds of resources. But the resource that we really have is reflected in this room. It is really a dedication to excellence in patient care, and it shows everywhere in everything that we do. And you know, I am humbled. I'm just humbled to be an Eisenhower nurse. Because, you know, I see the wonderful care that's given every day, and it just humbles me. So I just want to say thank you to every one of you.
This journey started a long, long time ago. I think probably 6 or so years ago. But Anne really took it and really made it happen with all of you. And so I want to, first of all, say thank you to Ann, our leader. And then to all of you here who have leadership positions in the organization and really worked with your teams to make this happen. I can't tell you how proud I am to be a part of this family, this Eisenhower family. It's an amazing place to work, and I'm just thrilled. I could cry. I'm so happy. So thank you all.
You can go ahead and cry if you want, Marty.
I'm holding it back.
So there's an old saying, find a parade and get in front of it. I feel like that's what I did today. Because it does feel like a parade. But I can't think of any word other than just joy. It's just sheer joy that I personally feel. And I knew we could do it. I always had confidence. And I think Ann would go, don't be so outspoken about it yet. You know, you never know what might happen, but it's a huge deal. This is just a major, major accomplishment. I said to Ann just a few moments ago, you know, when you look at the list of other magnet hospitals, so many of them are these big, major academic centers. You know, it's Stanford, it's UCLA, it's the major academic centers that have, you know, just a huge infrastructure to support it. But you did it, and thank you. It's a badge of honor and accomplishment, and I really like what you said, which is sometimes the awards that you see people getting, whether it's health grades or whatever, you wonder if it's the real deal or if it's a lot of tinsel. This is the real deal, and people work for it and deserve it, and just enjoy it and always take pride. Thank you.
And I would be remiss if I didn't call out just a few people. Firstly, I want to thank Dixon for everything that he's done. He's been an amazing magnet champion, a champion for the organization, and a champion for nurses. And we really recognize everything that you've done, Dixon. It's been amazing. And then I want to thank all of the council chairs, if they're in the room. I'd like the council chairs to stand up. All the staff nurses that have worked so hard. Yeah. And then we have our little magnet writing team. So we have, I've already mentioned Dixon. We have Annette and Dr. Margaret Beeman. And am I missing some? Were there just? Oh, and Mary Ann. How could I forget Mary Ann? Oh, my goodness, Mary Ann. I thought she was still on leave.
She was just jerking you around, Mary.
Yeah. So thank you. These people scratched their heads, did dances, talked to millions of people, and had amazing writing skills that put this all together to make a real cogent story and really exemplify all the work that goes on. So thank you to our magnet writing team as well.
Party. Where's the party?
Yeah, where's the party?
Don't tell me it's just back to work.
No, I think we'll have to plan a party.
Yeah, we'll be planning something special for everybody. So, for now, you got to go back to work. Thank you. Thank you, Ann.